ourselves for coming on a Sunday morning. And I would also like to thank each and everyone who has donated hair and is willing to donate hair, because it is of a great cause for a cancer patient. So I'll start with, as many of us are like women, what are the most common cancers in women are the breast and cervical cancers, which when we detect it early, it can be prevented. So our responsibility is to have a routine screening every year. And there are certain causes why it is, most of the times when patients come to us, they ask us what is the reason? Why did I get cancer? Why did I get breast cancer? Sometimes hereditary also plays a major role, but what are the other factors that can cause breast cancer is physical lifestyle changes. And if they say that research studies have shown that when breastfeeding is done, it acts as a preventive factor in breast cancer. And another thing is cervical cancer. If you see in urban setup, it is the breast cancer which is very common, but whereas when you see in rural setup, it is more of cervical cancer. It is because linked with personal hygiene. And so we also play a very major role. What role do we play? Our late chairman, Dr. Shanta, has told early detection is the most important factor in preventing cancer, and even if they are diagnosed with cancer, to give up appropriate treatment. And what is a psycho-oncologist? Most of the times, when people layman ask, what do you do? What is your role? Because doctors are there to give chemotherapy treatment. What is your role? The role of a psycho-oncologist in cancer setup is very important, because they are leading a normal life, and due to diagnosis of cancer, they experience a trauma. It is not only them, it is the entire family which goes through a lot of psychological stress. And there are various guidelines which have told that the role of psycho-oncologist is also equally important. So what do? We routinely see all the patients, and if you see when women come with breast cancer or cervical cancer, they have left the family behind, so they have concerns related to that. What will happen? Will I survive? So we are there to give an emotional comfort to the patients. So we routinely screen them for disease, and so they have again a doubt okay, when they give chemotherapy, I will have a hair loss. So what will I do? Can I go out? So that is when we came out with giving patients the process, that is mainly the wigs and the breast prosthesis also we provide the patient. And when we try to assess the quality of life, after giving wigs to the patient, it has actually improved over time, where patients have started going out, becoming more socializing, and it is of great importance. Wigs are of great importance for patients, because they feel we are trying to instill a self-confidence in them. So thank you for the Rotary Club to take this initiative in donating wigs to the patient, because it is of a great importance for them. And so routinely, all the patients, whoever is receiving chemotherapy, they come to us and they ask for wigs. And recently I've seen more of these adolescent girls, when they are receiving chemotherapy, they would have grown a long hair, and the loss of hair would be a major distress for them. So they come and keep on asking, will my hair grow back normal? Can you give wigs? So we provide them with wigs, and that itself gives them a lot of, a sense of happiness. We cannot do anything, but we can create a sense of happiness in them. And the wigs will be of great use, because it will help a lot of patients to improve their quality of life. So I'd like to thank once again the Rotary Club for doing this.